Communication in Nuclear Medicine Technology by Shannon Avers. Nuclear medicine technology is a form of diagnostic imaging. Using an intravenous or IV line, radioactive isotopes are administered into the patient. Nuclear medicine technologists then take images of a patient and can diagnose diseases by looking at the images. Usually, nuclear medicine technology is used to diagnose disease including cancer and heart disease. The severity of these diseases can also be determined via these images. Nuclear medicine technology is also used to treat many diseases as a form of therapy. I interviewed Trevor London, a certified nuclear medicine technologist and supervisor of diagnostic imaging at McLaren Macomb. Trevor gave me a variety of information about communication throughout the field that is used on a daily basis. Communication between technologists. In the article, Clinical Communication in Diagnostic Imaging Studies, the author, Peer Najad, writes about how technologists have many checklists they have to follow. Within this checklist, the technologist must be sure to get information about the patient in order to have correct images taken for proper diagnosis. As mentioned in the Request for Service protocol, a written directive signed by the prescribing authorized user is required prior to ordering any therapy dose. This means there has to be written proof for the test to occur. Trevor London also states that the writing done within this field is usually short and to the point. Technology. As mentioned by Hall in the article Coding in Nuclear Medicine from Examination to Tariff and the Iterative Process, coding used to be done with writing on paper, then sent away to be processed. Now it is done on a computer. A code is assigned to each image taken and sent away for processing. Most of the other communication within this field is through the computer, including the patient charts and contact between departments via email. The phone system is needed to talk to the patient prior to their test to make sure they are following the rules given to them before their test can be completed and to confirm the time of their appointment. Trevor London states that there is some use of pagers within the field also, as some people may need to be contacted immediately and they are very reliable. Verbal communication. Trevor London says most of the communication on the floor occurs verbally, with 20% information getting entered into patients' charts and 5% of communication being communicated via email or written letters. In the article, Clinical Communication in Diagnostic Imaging Studies, the author, Peer Najad, writes communication is key during these imaging procedures since many doctors are counting on the images to diagnose and treat their patients. If there is a miscommunication, there could be issues with the health insurance, and this could cause harm to the patient because they are being exposed to radioactivity without getting any results. Communication can be difficult when the technologists are busy with a patient or when they have a shift change. This can cause certain procedures to get done less effectively, and there is more room for error. Jargon. As shown in the myocardial perfusion imaging protocol, there is a lot of jargon used in this career, so you have to know who is being addressed when writing things. Since this protocol is written to the other technologist and the radiologist, there can be more jargon present. Technologists would need to change the wording for their patients so they will be able to understand what is being said and make sure they change the wording used when talking to the patients so that they can understand what they are saying using a minimal amount of jargon. Trevor London says that communication between coworkers is usually more casual and includes more jargon, and he explains that there are classes throughout school to help the staff learn the jargon within the healthcare field. Patient-technologist communication. Trevor London states that there are clear barriers within the patient-technologist communication with the amount of jargon present within this career. It can be difficult to talk to patients throughout the procedure. In this field, they follow an AIDET rule when talking to patients. This stands for acknowledge, inform, duration, explanation, and thank. This is necessary to be sure the patient is aware of what's going on, what test they are having, and to be sure they are comfortable during their test. This also includes a wrap-up with the patient before they are done with their testing. Nuclear medicine technology has a lot of communication of all forms present, including written, verbal, and communication through technology. Communication is present in email, including writing on charts, speaking to coworkers and patients, and when writing and following protocols.